Good morning, NeoMed community. It's my pleasure to be able to provide you the biweekly update today. I want to start, as always, by recognizing some of the great people on our team. First, since we've had the opportunity to meet last, we did learn that Ms. Zavala received a grant through the Ohio Department of Mental Health Services for $120,000, which will be used on campus safety measures through the work that she is doing. I also want to thank Dr. Patrick Gallegos and Dr. Natalie Bonfine for their leadership on the University Faculty Council. They've really taken the reins on helping to work with the President's Office in understanding the needs of our faculty members and created a new team that's focused on the exceptional faculty experience here at the university, where we can recognize all of the great things our faculty members do and at the same time ensure that we're meeting their needs. So a big thank you to them. And this is really the highlight for me, to be able to thank the members of our team for the work that they do for NeoMed. So I rely on you to please let me know through email or through reaching out to Michelle Mulhern in the Chief of Staff office, the recognitions that we should be sharing publicly. And we received one of those just this last week, was asked to recognize Carly Toth. Her work has really allowed the spring registration process to occur in a seamless manner. And she has been recognized by her peers and her colleagues as somebody who's been a truly outstanding performer at this organization. So thank you, Carly. Many of you know that we have created the Vitals program. This has been a concerted effort through the College of Graduate Studies and, of course, our Marketing and Communications office. So I want to thank Dr. Steve Schmidt and Mr. Rod Ingram, as well as Michael Wright and his team, for all the work that they've done. Vitals is value, innovation, technology, advocacy, leadership, and service. And it's really structured around how to be a leader in healthcare, something that NeoMed truly separates itself from the others in doing. We had the great pleasure of having our second event this past week, where one of our alumni, Dr. Rajiv Venkaya, who is the president of Global Vaccine Development for Takeda Pharmaceuticals, shared both global vaccine development during this pandemic, as well as how to activate leadership skills and change the way healthcare is delivered for our community. It was an outstanding event, and we look forward to our next one. And we ask that you please attend if you have the opportunity. Generally, these will be held on the first Thursdays of the month and beginning at 5 p.m. And our next speaker is speaking on innovation and technology, and that is how do we create groundbreaking new technologies to facilitate healthcare while also dealing with the issue of controlling costs. And our speaker is Mr. Mark Paul, who is the president of Stryker's Neurovascular Division, a multinational company, and we're looking forward to that presentation and ask that you please all attend if you are able to. Communications continue to be one of our biggest challenges at the university. We really try hard to ensure we're giving you both written and verbal communication around critical topics, but communication both horizontally and vertically is a challenge not only at NeoMed, but at every large organization. And we're doing our best to try and rein that in to ensure we're sending one clear, concise, and unified message. So I ask you to please work with us on doing that. And part of what I'm going to talk about next is really how we do that on some important upcoming events. So many of you know we sent out information written. I've talked about it in these venues in the past about our plans for de-densifying the campus around the Thanksgiving holiday and, of course, the winter holiday break. We're doing this not to shut down the campus. That's not our intent. In fact, our intent is to meet the requests given to us by the governor's office of the state of Ohio, as well as the Chancellor's Office for the Ohio Department of Higher Education. Now, we are all allowed as universities to shape these in a way that makes sense to ensure that we are still delivering upon our missions, having high quality education, conducting high quality research, and serving our communities. Working with our COVID-19 team that has been led by Dr. Joe Zarconi, and also now under the office of the Vice President for Finance and Operations, Mary Taylor, we are continuing to modify our approach to ensure that we have a safe campus that is also fully operational so that we deliver on our mission. So what we are doing over the course of the next 8 to 12 weeks is putting a number of measures in place to help us get there. So the campus is open for business, much like the rest of the economy. We are just continuing to work in a hybrid model of education where it's a component virtual and a component in person, depending on the needs of the educational curriculum that's being delivered. We also have the element of research that is critical to the university maintaining its ability to change the status quo, improve our foundational knowledge on healthcare and healthcare related topics that our great faculty members contribute to on a daily basis. And to do that, they need to be here. They need to run their laboratories. They need their technicians and assistants to be present. But we do so in a way that follows the safety protocols, face coverings, social distancing, hand hygiene, symptom reporting. And of course, if there's a substantial risk as determined by our COVID team and the Portage County Department of Health, that you may have been exposed to a significant level, or that you are positive, we're going to manage it through isolation and through quarantine. Otherwise, we have put in our variable work hours plan that allows our staff to be away from campus up to 2 days a week in order to de-densify the campus. The efforts that the governor has asked us to put forward has really been focused on our students and how do we reduce the student footprint? And their concern around the students is that unlike faculty and staff, many of them are originally from areas outside of our local region, whether it's other parts of the state or other parts of the country. We do know that during times of holidays, there's periods of travel, and we want to first make sure that our students aren't traveling outside the region and putting their own family members and friends at risk. And then when they return, that different environment they have been in than the one that we're used to here doesn't bring unnecessary risk into our organization. So as we approach the Thanksgiving holidays, we are going to be implementing the National Know Before You Go program. While that is not mandatory testing for our students, it is the ability for our students to get tested a short time before they would go, be able to get the results back so that they can now amend their travel plans. If they are positive, they're going to have to follow the state rules, and the County Department of Health will reach out to our students and they will isolate them and they will have to cancel travel. And any who are at significant risk based on the determination of the Department of Health will also have to quarantine, and that means cancellation of travel plans. Remember, this is not punitive. This is protecting you. This is protecting your family and your friends. And that is the reason we're doing Know Before You Go. We have decided to expand that to make this available to all members of our community here at Neomed, in addition to our students. So we have testing set up on this campus. It's free of charge. It's going to take place tomorrow, November 10th, then again on November 12th, and then finally broad testing just for the Neomed community on November 17th. So once you get tested under the Know Before You Go program, we ask that you reduce all activity, try and do a semi-quarantine until those results come back. If you're positive, we'll have to act on that with the assistance of the Department of Health in Portage County. And if they are negative, it's really in your best interest to try and keep yourself fairly isolated or quarantined. I'm not using the isolation term technically there, to reduce exposure to you before you travel. We do recommend that you do not travel during this time. It is not mandatory per state guidelines right now, but when you travel, you do put your family and friends and yourself at risk. And then when you return, there is an increased risk because of travel that you could be bringing something back. So our recommendations are not to travel at all. However, the state has said this is not a mandate. And so if you do choose to, please follow and use the know before you go protocols, if at all possible. When we return, when our students return to campus, you will be here on Monday, November 30th. We're going to follow a de-densified protocol for our students. That means we are here, we're operating, and we still have to deliver our educational curriculum in a way that's going to get our students the best results. That is being left up to the individual deans on how they achieve that. The guidance the deans have been given is to de-densify when possible, to do more hybrid, to do more virtual, but we understand that you may need to have students here for monitored testing, that there may be required laboratories such as compounding or gross anatomy or histology or small group sessions that will still continue to follow the rules that we put in place. Once the winter break begins for students, we will have plans for everybody to return and open the campus back up for business on January 4th. Now, we will follow those same densified protocols that I just described for the post-Thanksgiving period. And we're going to use those first 2 weeks as a semi-quarantine maneuver so that our students come back. We're going to ask them to reduce their contacts, to do only those things that are necessary and established by their deans here on campus, so that as we roll into the beginning of this third week, which would be approximately the 18th of January, that we can get back to business as we're doing it now. So it's fairly simple protocol for us to follow, and some written guidance is going to come out from the president's office on that by end of day today. For our faculty and our staff, again, we are continuing our protocols that are keeping this campus safe. We are open for business. It has been left also up to the deans and to the vice presidents for any latitude to do additional de-densification or reduction of the workforce on campus, understanding that we still have to deliver on what we do, which is education that is taking place on campus, research that is taking place on campus, and of course, daily operations and maintaining our physical plant. So that has been left in the hands of the vice presidents and the deans, and they've been given guidance on what to do for us to move forward safely. And what we're doing is safe. We are also planning to do random testing of our population following the governor's recommendations to us. Although not a strict mandate, the governor made it very, very clear that he is expecting all higher education institutions to do random asymptomatic testing. Our current plan is that January 3rd, 4th, and 5th timeframe, I should say 4th, 5th, and 6th timeframe, we will be doing asymptomatic testing. So some of you will receive a notification, student, faculty, and staff, to show up for asymptomatic testing, which will be taking place very likely at the drive-through window of our pharmacy. The state has given us point of care tests, which are very easy to use and can get results back within 8 to 10 minutes. We will monitor you using the swab to capture your own specimen. We will then take that, we'll process it, and we'll let you know the results in a very, very short time. We are then required to report this back to the state, who is tracking these results. Currently, we are required to do at least 3% of our population. There's a chance that that number will increase depending on what the governor asks us to do. As I said, we are doing a great job with COVID. We are never going to be at zero, but relative to our local economy and our local populations, we are doing quite well. Since the last week has transpired, we've had 2 additional COVID positive members of our campus, 1 student and 1 employee. They have very limited contact with others that is being managed by the Portage County Department of Health. Over a week period of time, that represents 0.13% of our total population. So again, doing very well. I'm comfortable with the way we're managing things, but doing more during the holiday periods to de-densify the campus and reduce that risk even more. The good news is many of these results are within our control. Please keep your face masks or your face coverings on. Please continue to maintain social distancing, hand hygiene, symptom reporting. And if you aren't feeling well, please do not come into work. Report the information to our COVID team so that we can continue to assist you in ensuring we have a safe campus. Part of that is ensuring that we are compliant with flu shots. We're doing really well from that standpoint. I want to thank all of you who've contributed. It looks like we are between our students and our faculty and staff. We are pretty close to 90%, but we do have 109 still outstanding. And so we're asking those individuals to please get their flu shots or at least come in with your documentation as to why you are unable to take the flu shot. Other good news for those of you who've kept up with the national news today, Pfizer has noted that they have tested 43,500 plus patients with their version of the COVID-19 vaccine and found it 90% effective, and they have not had a single substantial or significant adverse reaction to it. They are asking for emergency authorization use from the FDA that should get that vaccine out and available to the community. Looks like probably sometime in December. Its a direct availability will be depending upon the infrastructure that's been set up to do this rapidly, but we are all hopeful that this is going to make a big difference. And so when that is released, we have good scientific data behind it. We are going to encourage everybody to get that vaccination. And I will be one of the very first to step up here and do that because I truly do believe it's in our best interest and it is safe. So there is light at the end of the tunnel and we have good news ahead. I do ask all of you also to please keep Dr. Jay Gershon in your thoughts, in your prayers, as well as his wife, Carol. As an update, Dr. Gershon continues to be in the intensive care unit, the University of Colorado's healthcare facility in Denver. It's an outstanding institution that's doing a great job taking care of him, but he is still having substantial medical issues. We've been told this is not COVID-19 related, and it is believed to be associated with a non-Hodgkin's B-cell lymphoma is what was shared with us by the family. We'll keep you updated as we continue to learn more from the family members. I ask you also to please respect their wishes and direct any well wishes and communications through the president's office rather than reaching out to the family directly as they're still dealing with a very difficult time. I also been asked to address morale issues with you, and that really gets down to a couple of things. One, it's been a very difficult year. 2020 has been tough on all of us. We've obviously had the pandemic to deal with, and it's been a complete transformation on how we live our lives, leading to social isolation, leading to a lot of us being unsure about what it is we can do or should do. A lot of discord between the information we've been given on how best to manage the pandemic. We've had significant economic downturn because of the pandemic that's affecting many people's ability to stay employed and your ability to come in and work. And the way we manage day-to-day efforts at the university due to reductions in our funding from the state. We've also had a difficult year around a better understanding of the impact of systemic racism, political turmoil that is continuing to unfold. And although results have been released, I'm sure we're going to hear a great deal more. Depending on which side you are on, you're feeling differently about the outcomes of the elections. Independent of that, we will all move forward as a country, as a people, and we will continue to persevere and do well. I ask you not to let these times get you down, to reach out to your fellow Neomed Wales for support, to your family and your friends for support. Recognize that the holiday season and the winter season can be more difficult for some people as depression can become more prevalent, especially seasonal depression. And that's going to be on top of the depression or the reduction in morale that we're seeing because of the issues around the pandemic. So that will be a highlight and an intensification for many people. It's just best dealt with by reaching out to others, to doing what you can to maintain your health and your wellness, and that includes your mental health. So please do reach out, talk to other people. If you start to turn and feel down, please reach out and contact the university for help. We are here for you. It will be confidential. We will refer you to the appropriate sources. We don't want to lose anybody because of the stressors that can sometimes lead to people thinking that suicide may be the best way out. It never is. It's always a temporary state, and it's our job as a family to come together and to support each other. During these wonderful times of the holidays, it can be a difficult time for others. So please look out for each other. In the Air Force, we used to say, have a wingman. Your wingman is that person who checks on you, who you can reach out to, and you look after each other. So please find a wingman. And if you don't have one, contact us at the university, contact me. We will do everything we can to look out for you and your health and your safety. We're also rolling into a week where we recognize our veterans. Today, we're very fortunate to have one of our alumni, 2006 graduate, Dr. Gretchen Foley, who will be presenting a special Veterans Day talk from noon till 1. And it's on the topic of post-traumatic stress disorder and suicide prevention in our veteran population. So if you're available, I do ask that you take the time to listen and to support our alum and to support our veterans. Wednesday is Veterans Day. It's a day off at the university. We will be recognizing our veterans on Tuesday, where some of our team and our students will get out and both raise the flag as well as drop the flag in the evening. Please be involved at these events. If you're interested, we would love to have you there to support our veterans who've served our country. If you're a veteran, thank you for everything you've done. If you're a family member of a veteran, thank you, because you've done a lot also. The anxiety, the concern that you have when your family members go off to serve this country is just as profound as that experienced by our veterans. So please remember to thank a veteran. And thank you for the ability to, once again, be able to update you on our programs and recognize members of our team and address areas of concerns. And now I'll be happy to open it up to questions.
Yes, the first question, actually there's only one question from the students, is when will that communication be given from the deans, whether we are going to go fully online or the dedensifying of campus?
So speaking with our deans, they've shared that they've already released this message. I'm sure that following today, they will do this again. My understanding, I don't want to be careful about not countering what they've done, but my understanding is that they've made a pretty profound effort to reduce presence on campus for lectures, that some colleges may still have some monitored testing taking place on the campus in a very de-densified manner. But if you haven't received anything, please check your emails, and you should have something by end of day, I would hope. If not, please reach out to your dean's offices and ask for that information. The president's office will send out the written communication that I mentioned earlier by end of day today.
Another question came in is who or what department on campus will be keeping random COVID test records? Will tracking then only be done by the county health department, or is someone at Neomed also tracking?
So we have a COVID-19 team led by Dr. Joe Zarconi. Currently, we are working hand in hand with the Department of Health for testing results. While we will have results available for the January tests that are done point of care, and we'll take that information and send it on to the Department of Health. Anything being done through this free testing on the 10th, the 12th, and the 17th will be collected and sent to the Department of Health in Portage County. So you will be informed and the Department of Health will be informed. And the Department of Health is then supposed to keep our team informed. That information from those tests will not be released to Neomed directly. We are currently not what you would call a HIPAA covered entity, which means an entity that manages health information and healthcare. And so we are not going to be managing this ourselves. This is something that will be done by the Department of Health. And we rely on them and we rely on you to report positive tests to us so that we can keep up to date. That information stays confidential and will be protected. And the testing done, as I mentioned, with these point of care tests given to us by the governor, we are required to collect information, and it's de-identified information, meaning they don't know who you are by name, but we are required to send that into the Chancellor's office, the Department of Higher Education, and we are required to send positive results to the Department of Health for them to deal with. I want to be clear, we are here to manage information that's given to us, then manage the safety of the campus. We are not here to do the job of the Department of Health, which is really tracking the positive, the negative results, managing isolation and managing quarantine.
Just a quick point of clarification on the week of December 14th is included in the work from home / dedensifying for staff, or are we to come back to campus for that 1 week?
So again, that's just good that you asked, because I want to be very, very clear in our communication. We are here and we are open for business. Everybody who is able to do so has already been able to sign up for our reduced footprint on campus through the 3 days a week in place, 2 days a week at home. What I've told the vice presidents and the deans is that during that period that I mentioned, so after Thanksgiving and immediately after winter break, that they will individually look at how we meet that intent, that we are here, we're serving research, we're serving students who are on campus. And at the same time, is there a way for them to de-densify, meaning have a reduced footprint even beyond that? It is not an order that given to us by the governor back in May, where he said, get everybody off campus who doesn't absolutely need to be there. That is not the approach the governor's office is taking now. So we are independently saying, okay, take a look at your folks. It's the week after Thanksgiving. The number of students present on our campus needing services will be reduced. The number of people doing research on our campus may not be reduced. That's up to the faculty, the chairs, and the deans. I suspect they will be here and doing research and operating just as other institutions around the region are. So they need the people here to support them that need to be here. So I'm not going to make that determination. I'm leaving that to our frontline supervisors working with their leadership team to determine how best to implement that for this limited period of time. I hope that's clear. The communication that's going out will hopefully do it. We've done our best to make sure that that is also very clear. We are not moving into what we did in May, which is everybody off campus, only doing telework. The only people here essentially be police and operations personnel. That is not where we are. That is not where the state wants us to be right now. And that is actually not the way most of the nation is operating right now, because we do know that everything we do around social distancing, face coverings, symptom reporting, and hand hygiene works. It's when people don't follow that we have issues. So we are very strictly enforcing that here. We're just trying to create some additional measures because we know that despite our recommendations that people not travel during the holidays, since it is not a state mandate or a federal mandate, some people will travel, and we're trying to put just some additional measures in place to make up for that issue.
There are no further questions.
Great. Thank you. And thank you, Michael, for moderating. Have a wonderful week. I look forward to addressing you all in the next 2 weeks. Everything that I shared with you, just please remember that it's not, it is set in stone, but it's not. If the governor's office or the president comes in and asks us to make a modification, we will. And we're going to follow what they tell us to do, and we will get back with you much more quickly than just every 2 weeks. So thank you. Be safe, be healthy, and please do let us know if there's some way that we can help, and do look out for each other.